Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Invest in your health. That is the best investment you'll ever make. Good evening. Welcome to yet another episode of BMC Global Life Al Hilal Health World, nothing but lifestyle. Today we'll be discussing a very important disorder that affects 5 to 10% of women of reproductive age worldwide. And that means about 1 in 10 women could be impacted by this disorder, polycystic ovary syndrome. And to give more insights on this topic, we have with us Dr. Jasmine Shankaranarayanan, specialist in obstetrics and gynecology at Al Hilal Hospital, Salmabad, with over 13 years of experience. Welcome to the show, doctor.
Thank you.
Let's address the elephant in the room. What is PCOS?
Okay, PCOS is polycystic ovarian syndrome. So this is like from the term itself, polycystic, and it is multi-system endocrine disorder. It's a very common disorder nowadays in women, and it's mostly affecting women in the reproductive age group, that's the childbearing age group. So earlier, when it was first detected or seen, it was like only 4 to 6%. But now the incidence has risen to around 20 to 30% of the women in this age group. So this is mainly due to the high testosterone levels in the body of these women, and this results in, it's characterized by ovulation or the inability of the ovaries to function properly. So that results in an ovulatory condition. Ovulation means, ovulation is the release of mature eggs. At every cycle we release one mature egg, which is necessary, for the normal reproduction. But in such women, that doesn't happen. There is because of the ovaries not being able to function properly due to a high testosterone level. So PCOS is supposed to be the most common condition that causes a high testosterone level in women.
Okay. In some studies, it is stated that PCOS is most common in certain populations or regions, or in specific ethnic groups like Hispanic women or South Asian women.
Right. Yeah.
Is it true? Yeah. Or what are the causes for PCOS?
So, actually the underlying cause is not very clearly identified, but based on, like you said, some genetic factors and all, certain populations are more prone to this condition. For the Asian population is highly prone. The African population is also very prone. But nowadays we are seeing that universally there is an increase in this condition. So that is because of our lifestyle changes, right? And so the lifestyle is being considered one very big risk factor. For example, the sedentary conditions in which we live nowadays, and the choice of foods that we taking more of processed foods, going away from the basic foods. So those things have been found to be a very important reason or a risk factor in these women. Then The polycystic ovarian syndrome is one condition which we are seeing both in perimenarchal age group, that is when a woman gets her menarche, the first period. So in that early age group, 10 to 15-year-old girls have started slowly developing it, though it has not become very established. But the most common population that is hit with this condition is the reproductive age group, the childbearing age group. So in these women, it is said to be at least 20 to 30% of the women are being affected by this. And other risk factors, if you tell me, we see this more commonly in girls who are very obese or who have other risk factors in their family like diabetes, hypertension. So it comes as a part of like a metabolic syndrome where the girls are, they are overweight also. They may be having other conditions in their family like I said earlier. And even when they will be, showing some symptoms of menstrual irregularities, which is the commonest thing that we see.
Okay. What are the symptoms of PCOS?
So coming to that, like if you have to say that somebody has a PCOS, there are 3 criteria we say, and at least 2 of the 3 criteria should be fulfilled to say that some girl is having PCOS. Okay, so one of them is the condition of the menstrual irregularity. It is heavily, very, very common with a PCOS woman. So the menstrual irregularity that she usually complains of will be scanty periods. Okay, the normal period range should be between 3 to 7 days in a 28 to 30 day cycle. So these girls will have maybe 1 or 2 days of very, very scanty flow. She may be only having just a spotting, and dysmenorrhea or the period pains is very common among women, and it is usually a sign of that the ovaries are functioning normally and ovulation is happening. But in girls with PCOS, this period pains are usually absent. The other issues will be, she will be having a very high testosterone levels. Okay, so this high testosterone levels will be seen as skin changes or body changes. We can see it externally. So some of the features of the high testosterone level in these women will be, there will be male pattern baldness that she will be developing. Okay, male pattern baldness, like the temporal balding will be there. Okay, and a diffuse hair loss. Okay, other than that, she will have facial hair growth, just like she will develop beard, and also mustache in different varying ranges. Okay, so that is another thing, we call it hirsutism. Facial hair growth and even body hair growth will be there. Other than that, a little bit of coarseness of voice may be seen if there are other reasons for high testosterone in her. The other things that we usually see with a high testosterone level will be obesity will be there, and there is a condition we call acanthosis where there will be hyperpigmented skin. Okay, the very thick and dark colored skin in the nape of the neck and in the armpits. Okay, so these are some common things, and there will be pimples. Okay, she will develop acne. Okay, so these are the conditions where there's because of the high testosterone level. Then the third criteria is the ultrasound diagnosis. On ultrasound, on such patient we do an ultrasound, and we see that the ovaries are showing something what we call like a necklace pattern because of the arrangement of immature follicles. As I told you, there is no ovulation happening. There are no mature follicles growing in the ovary. So there will be like tiny eggs at the follicles at the periphery of the ovary. So any of these criteria should be there. Okay.
Yeah. The last part you mentioned, the test is ultrasound.
Yeah.
Apart from that, is there any other tests to detect PCOS in patients?
Yeah. So I would like to elaborate on this ultrasound thing because that's the basic test you can do for any woman who is having these menstrual issues or other complaints. So on ultrasound, the main things we notice is that the ovaries will be little larger than normal. Okay, they'll be appearing little bulky, and there will be the necklace pattern what I said. So many girls or women get very afraid that, oh God, I have developed cyst in my ovary. This is not cyst. I would like to clarify it once again. We keep telling that to all our patients who are coming to us that this is not a cyst. These are immature follicles that are like appearing as a circle around the ovary, and we should not consider it as something very dangerous or a big cyst. It's not a cyst. It is just the follicles, the regular follicles in the ovary. Only thing is they are not maturing. Okay. So that is one thing that we can see on ultrasound. So at least you can see 12 small follicles, okay, around the ovary. Then the other thing that is there usually will be because of the menstrual irregularity and the hormone imbalances, the thickness of the endometrium, that is the uterine lining, the inner lining of the uterus is called the endometrium, that will be appearing very thickened. So these are some findings you see on ultrasound. Like you said, there are blood tests also we have to do, because this is usually because of a testosterone excess in the body. So we will definitely look for the testosterone levels. We will also have to look for the testosterone levels to check if there is any other reason for her high testosterone level and these symptoms. The same symptoms other than PCOS can also happen if you have some testosterone secreting tumors in the body. So that has to be looked for. Then the more common tests are thyroid test. Thyroid test is very important because what we are thinking as PCOS, it may be either associated with a hypothyroidism, or all her condition, all her symptoms will be not because of PCOS, but it may be because she is having a thyroid issue. The other hormones we will look for is the prolactin hormone, and all these patients are highly prone to, unfortunately, they are highly prone to developing diabetes in future. And with PCOS, like I said, because it's an endocrine, it's affecting all the organs in the body, there will be an associated insulin resistance. Okay, so she will be producing a lot of insulin in her body, but her body is not able to utilize it to maintain normal sugar levels. So she will be prone to diabetes later in future. So we have to check her insulin levels, her sugar levels. These are some regular tests we do.
Doctor, you mentioned before that it is very common in women. So my doubt is, was it always prevalent in women, or is it occurring right now due to the change in lifestyle?
Yes, definitely. This was not so common like couple of years back, but now the prevalence is like really high. Every like you said, 1 in 10 women we're diagnosing them to have PCOS, and they are having the symptoms, and we are worried that they will have more complications, and we have to act immediately. We have to do the necessary treatment.
Okay, thank you. We were talking about lifestyle changes. So one such factor is food habits as well, that have changed drastically over the years. What is the role of diet in management of PCOS?
Okay, so earlier, like if you look back into the era of our grandmothers, you can see that they are very physically active then. We are having desk jobs, so that is one problem, like sitting hours and hours at the desk. Now after work hours also, we are logging on to our internet, and we are still being couch potatoes. So sitting is the new smoking.
Okay.
That that is the main issue that we all are facing nowadays. So coming to the diet, so the diets were not processed earlier. Now we are getting more processed foods to make our lifestyle cooking easier. Okay, but these options that make it convenient for us, they are also not good for our body, because with the processed foods and all, like there is more preservatives in that, and it's like immediate gratification. You just pop it in and you are immediately releasing sugar into your body. Okay, they have to be slow energy release foods that we should take. And yes, definitely high salt content foods like chips packets and all, and sugar content foods, I think everybody knows about it. Generally that kind of diet has to be restricted to as much as possible. Okay, because these high slow energy release foods, like what we used to eat earlier, like rice and chapati, all those things, and a lot of vegetables and all were there. Less of non-vegetarian food. Now it's being said that it's good, but we should be careful about the kind of cooking. Like not too much of oily foods and not too much fried foods. Instead, grilling, baking, all this is being adopted, and people are like trying their best to get back into that healthier lifestyle. So that is the main thing about diet, because it will help to improve our insulin sensitivity. And if the insulin levels are acting normally, the other hormones will also be in line, and they all will act accordingly, improving our hormone levels, and these issues can be resolved.
Okay. What is the treatment given to a PCOS patient?
So PCOS, as I said, like different women come with different complaints. Okay. So if it's a younger girl, her main problem is her menstrual irregularity. She is either having scanty periods, or more commonly, she is getting the periods like maybe once in 2 to 3 months. Okay, 2 to 3 months there is no period, and when it comes, she keeps on bleeding for 2-3 weeks. So that's affecting her school performance and her confidence levels, everything. So that is for these kind of girls, we have to treat the menstrual irregularity. So the treatment for her, like I said earlier, the basic treatment will always be for all PCOS women will be the lifestyle modification. So if there is anybody who is into smoking or alcohol, that has to be totally restricted, and the diet modification and exercise. This is the basic that we have to advise everybody. That is the first thing that should be implemented. And usually, if the symptoms are not very severe, we suggest that for 2-3 months she follows just this, okay, and that itself brings a huge change. So because now children, we see these adolescent girls, boys, they are ordering everything and getting these chips and all, they are taking it on a daily basis. So that is the first thing we ask them to change. Usually when they change that pattern, within 2-3 months, they see some kind of changes, okay. Now coming to the treatment aspect, there is a medical treatment and surgical treatment. So the medical treatment usually is hormone tablets have to be given, okay. And these hormone tablets, unfortunately, or like it will depend, so we have to give a very good counseling to our patients that she may need to take it maybe for a very short period, depending on how often her symptoms are coming and how quickly her symptoms are getting corrected, okay. So some temporary relief we have to give, especially for these menstrual irregularities. So if she's coming with menstrual irregularity, that is like hormone tablet, okay. We will give it like for 1 or 2 months to correct the cycle. We will correct the cycles first. We have to also associate it with that she may be suffering from a lot of vitamin deficiencies. We need to check for her vitamins. We need to start like basic vitamins that will be deficient in PCOS woman will be vitamin B, vitamin D. These all deficiencies will be there. That also needs to get corrected. So till she's getting onto her lifestyle, getting back into her normal lifestyle, till then you have to supplement with all these things. So these are the basic treatments. And like for this insulin resistance, we have some other tablet which we give actually for diabetic patients, but it is also useful for women who have PCOS to improve that insulin sensitivity.
Ma'am, one of the key features of PCOS is the overproduction of androgens, which are considered as male hormones. So one of my friend, she is also a PCO patient. Okay. So when I said I'm talking to a doctor about this, she gave me a doubt to be cleared. You were talking about that pigmentation, blackening around the areas.
Yeah.
So how can we treat that and acne as well as the facial hair on growth in bodies? How can that be treated?
See, the thing is, for her basic hormonal milieu to get corrected, that will take some time. So, patients who are having those skin issues are most tormented because that is something that bothers them a lot, affects their confidence. So that will definitely need a little more aggressive treatment. For example, for the acne, along with, she will mostly, because it's not the regular kind of acne that's coming, it's the hormonal reason is there. So the hormones can be given for that also. Okay. Usually they come first, they will be visiting the dermatologist and all, and they will first initially try to use only the topical treatments, like maybe some gel or face washes and all, but that is not sufficient for patients who are having the PCOS also, because the hormone has to be corrected. So hormone tablets can be given for 2 to 3 months, and it is safe only. Nowadays the hormone tablets have very minimal dose of the hormones, so that the side effects can be countered.
So there is no such home remedy as such, only medication.
Home remedies, all these can be used in combination. There is no harm in that, but this PCOS will definitely need hormonal treatment. At the same time, like you said, for hirsutism, that is the facial hair growth and all, again, to control new hair growth, hormones have to be started. Okay, then only it can control the hair growth till her hormones have become normal. Okay. So, but the old hair growth that is there, that again needs a special mention, because they start the hormones and they are not happy usually. They say that still the hair is there on their face. So the thing is, the old hairs that have come, that does not go with the hormone tablet. It only prevents the new hair formation. So for the old hairs, like she will have to, for time being, temporarily use other methods also, like she can use any depilatory methods like waxing or threading, or now the more common, the good methods are laser treatment. Okay, in a couple of sittings, she can reduce the hair growth very effectively.
Ma'am, is PCOS treated by surgery?
Yeah, so that is the third level of treatment, and the less opted for. Okay, as I said, PCOS is not ovarian cyst. Okay, it's only the immature follicles which can get maybe resolved over time with the treatment. So for surgery, we keep it only for cases where the patients are like the medical treatments we are giving is not of use, that doesn't work out in their case. They still keep on getting the symptoms and the menstruation issues are not solved. So it's for them, and it's for patients who have infertility. Okay, we didn't touch infertility till now. A huge group of patients coming to us with infertility or also having the infertility because of the PCOS. Okay, a very common cause. So for them, the advantage of doing surgery, we usually go for laparoscopy for them. We call it a diagnostic laparoscopy because we want to look out for other causes of infertility also. So that is the advantage. What kind of surgery we can do for PCO is we call it the laparoscopic ovarian drilling. Okay, where we just puncture these small follicles, the immature follicles. We can just puncture it so that it releases out the androgen fluid. We say the testosterone fluid is released out. That will improve the hormonal balance of the body, and also in the first 1 year we have noticed that it has improved the fertility also. Okay, but yes, and other than that, the advantages are we also have to look for the tube patency for women who are trying to get pregnant. That can be done in the same sitting. We can also look out for other causes of infertility like fibroid, endometriosis. So it will be like you can diagnose and treat at the same time. So that way, for infertility patients, it's a good option. But the problem with the laparoscopic ovarian drilling, sometimes we come across this, that after 1 year of treatment, slowly, because of the surgery, the patient starts developing adhesions inside, and that can become an added reason for the infertility. And a more dreaded complication or problem with this drilling is that the patient's ovaries may start failing. If the drilling has been done like very aggressively, too much drilling has been done, it damages the ovaries. So whatever treatment we do, it should be only cure, it should not do any harm. That is the basic principle, right? So that is why it is done very, very sparingly.
Okay. Does PCOS lead to long-term complications?
This is the most important thing about PCOS, that when we see a woman with PCOS, the principle should be to treat it as early as possible. Start the treatment as early as possible because it is related to long-term complications. So as I said, in future, if the PCOS is not treated, she can go in for diabetes. Okay, she'll be a diabetic later in life. She can develop hypertension also secondary to that. There can be obesity. There can be cholesterol issues. Okay, she will be suffering from high cholesterol levels. There can be cardiovascular problems. Heart problems will be there. All this will come secondary, one after the other one. It's like a vicious cycle, one will lead to the other. So these are some long-term complications, and last but not the least, we have to, she will be at a high risk for developing cancer of the uterus.
Okay.
Yeah.
That sums up our session, ma'am.
Yeah.
Thank you so much for the beautiful insights on PCOS. It was a pleasure talking with you.
Same here.
I hope you all had an amazing session on PCOS and its precautionary measures that must be taken if you detect this disorder. For more such informative sessions, please tune into Al Hilal Health World every Tuesdays at 8 p.m. only on BMC Global Life. I'm Abhijit Joseph signing off. Good night.
skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.